It's well known that October is Breast Cancer Awareness Month, but what you may not know is that it's Male Breast Cancer Awareness Week. The numbers for women are staggering. More than 266,000 expected to be diagnosed this year. Though not as common, men are also diagnosed with breast cancer and face issues of their own. These are the pictures of breast cancer thrivers from across the globe. A small group of men whose stories are hardly ever heard.
I am so sorry. What is he doing here?
Men get breast cancer too. It is a real thing.
ABC's new series, A Million Little Things, hitting the subject head on, tugging at our heartstrings with the story of a man who's in remission from breast cancer.
The all-clear screening I got this week just gives me permission to hold my breath for another 3 months.
It makes men seem more vulnerable, which they are.
Breast cancer thriver Bret Miller opening up, showing us his scars. He was only 17 years old when he noticed a lump behind his right nipple. After 7 years of doctors dismissing it as puberty, he then took a mammogram, which revealed he had breast cancer at just 24.
I come through the door and it says Women's Clinic. Mind you, there are other men that are in there, but they're there with their significant other. So I go back, have to take my shirt off, put on the pink gown. It was uncomfortable and awkward.
A mastectomy and 4 rounds of chemotherapy later, Miller is cancer-free. But the road to recovery wasn't easy. According to the American Cancer Society, 1 in 844 men will have breast cancer in their lifetime, compared to a 1 in 8 chance for women.
I wanted no other men to be alone when they hear the words you have breast cancer, because that's essentially how I felt.
So Miller co-founded the Male Breast Cancer Coalition, which offers support to more than 300 men and their families.
We're talking an average of 6 to 7 men a day right now.
It doesn't feel like I'm alone anymore because I have so many other brothers with me in this fight.
He certainly does, and we're so glad that Bret is doing well. Let's bring in our chief medical correspondent, Dr. Jennifer Ashton. I'm so glad we're talking about this.
Me too, Robin.
You know, and what are the similarities and differences?
Well, let me be clear. If you have breasts, which obviously is men and women, you need to know the signs and symptoms. That's the most important thing. When we talk about breast cancer, we're talking about things like a palpable lump or mass, skin changes, a dimpling of the skin, or nipple discharge and/or a change in the nipple. That can happen in men or women. The good thing, if you will, with men is that their breast tissue is much less, so they can usually pick this up, you know, pretty easily. They can feel it.
Yeah, and a self-exam, which we are always stressing, and you're going to show us a little demonstration here.
Yeah, now, listen, this is not for the patient to determine, but in general, in medicine and surgery, when we feel a firm and fixed mass, it doesn't roll around under your skin, that's a little suspicious for a malignancy. When we feel something that rolls around, it's maybe a little compressible, that's less concerning, but I want to be clear. Anything you feel in your breast, whether you have an X chromosome or a Y chromosome, you get that checked out.
But it is helpful to know the difference because I did regular self-exams, and when I felt that, I went immediately to the doctor. I actually moved up my appointment because I knew that it was different like that.
Absolutely.
So what are the chances of survival?
Well, listen, like women, the chances of survival for male breast cancer is determined by the stage, the grade, whether lymph nodes are involved. The bad thing about male breast cancer, Robin, is that even though it might be easier for them to pick that up, and we're talking about, you know, about 2,500 men a year in this country, they might feel it sooner, but because the anatomy is closer together in a man, it's actually generally picked up at a more advanced stage because, again, there's not that much space between the nipple and the ducts and then the lymph node system.
Are some men more at risk for breast cancer?
There absolutely are risk factors for men. And when we talk about male breast cancer, we're talking about genetic mutations. We hear about the BRCA mutation. Men carry that mutation too, and it increases the risk of breast cancer, pancreatic, and prostate cancer. Age, same thing as for women. Exposure to estrogen, whether that's by medication or obesity, if you have a history of breast cancer or male breast cancer in the family, other medical conditions and obesity, these risk factors are common, so men need to know about it.
We heard in the piece with Bret, He had this lump.
That's right.
Doctors kept saying, oh, no, 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 it's something else, something else. As women, we face this when it comes to heart ailments. You know, when we have
absolutely.
Why in your profession? This
Robin, you're talking about something so important now in medicine. It's gender inequality issues. There are diseases like depression, heart disease, that differ in their presentation for a man versus a woman. Then there are things with a lot of similarities. Breast cancer, for example. But what men face here in terms of actually a gender stigma is wrong, just as it's wrong when women face it. So when we talk about this, we want men and the circle around them to know we see you, we hear you, you deserve to be treated appropriately. And just think about the awareness. The awareness campaign for breast cancer has been amazing. But Robin, the color is pink.
I know.
This should have no color, and that's what we're doing here.
Recently went through it with my big brother. Was with him over the weekend. He just celebrated his 70th. He had a tumor. It just was recently removed. Thankfully, it didn't spread, and it was in his breast, and he's going to be okay.
Thank God.
So I'm so very happy. So very happy about that. Well, hey there, GMA fans. Robin Roberts here. Thanks for checking out our YouTube channel. Lots of great stuff here. So go on, click the subscribe button right over here to get more of awesome videos and content from GMA every day, anytime. We thank you for watching, and we'll see you in the morning on GMA.